Well, for those of you, hey Nick. So if this is your first time in Philadelphia, welcome. I have the pleasure of saying this because I used to be a resident here at University of Pennsylvania, so partially Philadelphian here. Okay. So, oh, my computer. Okay. Okay, so today what I'm going to talk about is the science behind 4D aligner and all this shape memory effect hype that everyone's talking about. So if you're familiar with clear aligner, you all know that it is made from 3D printing. So the conventional way of doing clear aligner is through 3D printing models, and then you have these vacuum form process of making all those aligners. But what I want to start today is trying to ask you this question. How accurate are these thermoform aligners? How accurate you think the aligners that you make in-house with all those suck-down machines are? So there are three key disadvantages of thermoform aligners that I want to say. First is the variation in aligner thickness. So try to think of this. So when you make a clear aligner with a thermoform process, the first point of contact where this tooth touches that plastic is the cusp tip, right? And when it stretches, it's going to ultimately become thin. So if you look at the label for let's say Essex and all those clear aligners plastic, it usually says we have a thickness of 0.75 millimeter. But how thick is it eventually? And if we look at the graph over here, you can see that the cusp tips and the edges of the aligner are actually thinner than you think. So if aligner thickness is directly related to the strength of the aligner, then if the thickness is variated, then the force system itself, it doesn't necessarily as what you think, because force system is going to change. And then there's also another thing. So the gap between the aligner and the tooth, there's got to be some variation. So at the cusp tip, the gap would be very tight. So that's where the aligner contacts the tooth at its tightest point. But then as it stretches out, at the undercuts, at the slopes, at the margins, the gap is going to become bigger. So for a aligner system, you have a net force, which is the force that you design. But if the actual force is different because of the difference in gap, you might end up in a net intrusion force, and that is actually the most common side effect that we see when teeth start to get off track. And there's also another thing. So we have attachments, we have undercuts. How well does the aligner adapt to the tooth underneath those attachments and undercuts? There's got to be, again, bigger gaps over here. So if the aligner is not gripping the tooth really well, then the net force is also going to be different, and then you start to experience off track again. So those are lack of aligner adaptation at undercuts. Those are the things that probably makes traditional thermoform aligners less accurate as you think. So if only aligners can be directly printed like what we have over here, and that's how probably we can overcome these difficulties and try to make the aligners more accurate. So the three key potentials I think that direct print aligners brings us is firstly thickness. So again, if you try to remember what I just said, so when you do thermoform aligners, you can't really control the thickness of the aligner. But if you can direct print an aligner, then first of all, you can control a thickness that is uniform. And for some cases, when you want to have translation instead of tipping, for say Invisalign, they have these G6 protocol. But if we want to do direct print aligners and do a translation, we can actually produce an aligner that has multi-thickness. We have thicker aligner material over here at these points where we can produce certain torque and make these teeth translate but without tipping. So this is one of my case. So I try to distalize the second molars. Now, if you do conventional thermoform aligners, because of the gap that is going to appear between the first molar and the second molar, so during the process of thermoforming, the clear aligner will start to embed into the gap between those two teeth. Now that's where the aligner thickness is going to get thinner than you think, but that is actually the place you want to have a larger force. So if we do a dark print aligner, we can actually thicken this part over here and try to make this, the gap between the 7s and the 6, much thicker than you think, and thereby producing a much larger force, and that is exactly where you need the force to be at to try to distalize those two teeth. So another design that I did was for a lingual retainer. So this is a clear retainer case. Now for lower teeth that had crowding before, usually the most common thing you see in relapse are lower teeth started to get crowding again. Now if the patient doesn't want to get lingual fixed retainer, or the doctor does not want to get lingual fixed retainer, you can get the patient a clear retainer, but with a thickening at the lingual side of the lower teeth. Thank you. With a thickening at the lower teeth. And that's how you try to make sure that the lower teeth the retainer has a really good grip on the lower teeth. Now, another advantage of dark print aligner is the aligner tooth gap. You can actually control the tooth gap. Now, this is something that's really good, especially in cases where you want to extrude the tooth. So we all know that it's very difficult to extrude a tooth, but if you have more thickening at the margin, that's where you want to have a tighter grip at the margin, but you also make some gap between the aligner and the edge of the tooth. That you can actually create a gap that encourages the tooth to come down. So this is one of the advantages that you can do with dark print. So you can create gaps where you want to push the tooth into and then encourage the tooth to move into that direction. Now, another thing that people have been talking about is the potential of having fewer attachments for direct print aligners. So the reason behind is that for direct print aligners, you can make aligners that actually go into the undercuts, so you have a better grip of the tooth. For thermoform aligners, you can't get into the undercuts, right? So you have to have extra attachments for the tooth to be better gripped on. But if you can get into the undercuts, then maybe you can get fewer attachments. So this is another, I think, very big advantage of direct print aligners. One more thing I think is freedom in design. So this is a case by Dr. Kelvin Chan, and he has a first molar that is extruded, and he wanted to push the tooth up. For these kind of cases, you would sometimes think, okay, maybe we should put TADs, right? TADs on the buccal and on the palatosis. Try to put a power chain over there and push that tooth up. But if you have a dark print aligner and you want to intrude the tooth, you can actually design buttons over here on the buccal and palatal side, but that also part of the aligner itself. And then if you make these cuts on the occlusal surfaces of the tooth and then put rubber bands over, you can actually intrude that tooth without placing tests. So I think this is a very genius design that is only made possible through direct printing. Now, of course, if you want to do mandibular advancements, you can have these little wings that are printed out with the aligners. So next thing that I want to talk about is the shape memory effect that everyone is talking about. Does anyone know what shape memory effect is? Anyone?
I've seen the video.
You've seen the videos? That's the video that I'm going to show. So for these aligners, if you distort them in a crazy way and we put them into hot water, they spring back. But what's the magic behind that? Now, for conventional thermoform aligners, once the aligners are distorted into this way, usually they're done. There's no way of recovering them. But for 4D aligners, which we're introducing today, they have this kind of magic. And the magic behind, this is what I'm talking about, is the magic behind this ActiveMemory Polymer. I'm going to show this video first. So this is not related to our aligner, but this is what shape memory effect is in plastic. So you see this little boy over here with this car? So there's a string attached to the car. Now once the heater is turned on, because of the temperature, the string shrinks. That plastic rope shrinks and then brings everything up. And again, we have another example over here. So you see that leaf over there, it's wrapped around by a plastic rope. But once the heater is on and the temperature rises, it sort of like shrinks and then cracks the leaf. So this is shape memory effect. Now, what does it have to do with aligners? How is it incorporated in aligner design? So before I start to talk about shape memory effect in aligners, I want to talk about wire properties. So if you've been to ortho school, you know that wire usually we have nitrile wire, we have TMA wires, we have stainless steel wire. And then for nitrile wire, we have this shape memory effect, right? So we have this austenite, martensite, and different phases of nitrile. The way that nitinol moves teeth is that it remembers the shape that it originally has, and then once you put it on teeth, it sort of like drives all the teeth back to its original shape. So this is the shape memory effect we know in alloys. Now, but when it comes to aligners, we're often clueless. We don't know what the composition of a liner is. But this is, I think, very dangerous. So, just imagine if you go to a doctor and you ask the doctor for a painkiller, and doctor just gives you a painkiller, but without knowing the pharmacology behind. They don't know if it's like acetaminophen or it's ibuprofen. I think that's quite dangerous. Now, for orthodontists, if we use fixed appliances, we all have to go through school and trying to learn the characteristics of these wires. So we know wires before we start to do braces. Now, in aligner cases, before we didn't have any idea because that's usually considered company secret. But today I'm going to talk about what is the secret behind LuxCreo. And I think before that we need to start to know polymers. So if you want to treat patients with aligners, I think the most important thing is we have to start to learn to know what polymers are. Now, so we're going to start with a little bit of organic chemistry. I think everyone probably learned this before, but way before dental school. So this is probably during college or even high school. But I'm going to break it down into very, very easy. So if you look at the structure of a polymer, it's usually either a crystalline polymer or amorphous polymer. Now, crystalline polymers are very tightly stacked. Amorphous polymers are they don't have a particular shape. The clear aligners that we usually use are mostly amorphous polymers. So I'm going to talk a little bit about amorphous polymer. Now, amorphous polymer is very less dense than crystalline polymer. They usually have a gas transition temperature. So I'm not sure if you've ever heard of this term, but if you ever read some papers about direct point aligners, they usually talk about gas transition temperature. Now, the notion of gas transition temperature is actually quite similar to melting point. So if I talk about melting point, you may think of ice. So ice has a melting point of 0 degrees Celsius. When temperature rises above 0 degree, ice becomes water. So in a solid state, H2O becomes in a liquid state, so that's water. Now for amorphous polymer, they have this very similar idea. So scientists call this gas transition temperature instead of melting point. So below a gas transition temperature, this plastic or this polymer is usually in a gassy state. So very hard, it's just like a solid state. But once you raise the temperature passes the gas transition temperature, it softens. So like glass, so it turns into liquid glass, but it's not actually liquid. I might use one example that most of you guys are familiar with. That's contact lens. So the contact lens that you wear in your eyes, so say if you go skiing, so if you go to like a really place with a really low temperature and you take out your contact lens, it becomes like glass. But once you put it inside your body, because of the temperature of your body, it raises, and then it starts to become rubbery, right? So it starts to become like elastic. So this is glass transition temperature. So once it passes the glass transition temperature, the polymer softens. So we have this chart over here. So when the temperature rises, the stiffness of a polymer drops, and it turns from a glassy state through a glass transition period and lands in a rubbery state. So it softens up. Now, what does it have to do with shape memory effects? It has everything to do with shape memory effect. So for the plastic that we have for direct print aligner, for LuxCreo aligners, they're usually composed of at least two components. So they have this, what we call net points or hard domain. So these are one component that has a very high glass transition temperature. So usually at either body temperature or in hot water, they're still in a very solid state because their glass transition temperature is much higher. It's much higher than body temperature. It's much higher than hot water temperature. Now there's also another very important component inside these LuxCreo aligner. It's called, scientists call that a switching segment. So a switching segment, unlike a net points or unlike a hard domain, it has a relatively lower glass transition temperature. Now, so this temperature is a temperature we're going to play with. So the video that we just saw, if you throw the aligner into hot water, it softens up and returns to its original shape. Now that's because the temperature of the hot water is above or close to the glass transition temperature of the switching segments. So this is something we're going to talk about today. So I did some little cartoons just to explain this better. So for our 4D aligner, for our shape memory aligners, we have these red lines over here. Those are the hard domains. So these red lines, these hard domains have a really high glass transition temperature. So they don't change. They don't change state. Whether you're under body temperature or whether you're in hot water. So they serve like a scaffold, like an architecture scaffold for the whole aligner. Now we also have these blue zigzag lines, which are the switching segments. When you put the aligner into your mouth or into body temperature, the temperature drops. So when the temperature drops, it drops below the glass transition temperature of this switching segment. So let's say, for example, if the glass transition temperature of these blue lines are 60 degrees, and you place the aligner into your mouth, that's close to like 37 degree or 40 degree, right? So under this temperature, because it's relatively colder, the switching segment hardens. It becomes like glass. So now it becomes very hard. And then it also overpowers the hard domain, the red lines over here. So when we were in a higher temperature, the picture below, what determines the shape of the aligner or the whole structure were the red lines. Because the blue lines back then were very soft. They didn't have any force or any strength. But once you lower the temperature, you put the aligner into the mouth, the blue lines become much harder and it overpowers the red lines. So what is now holding the aligner, holding the strength and the integrity of the aligner is the blue line now. Can we get another mic? Yeah. Sorry for that. Is it? It's out of battery? Okay. We're back in the game. Alright. Is it better now? No? Okay, I'm just gonna shout. Yeah. So you can all hear me. So once the aligner is inside the mouth, because the mouth or intraoral temperature is a colder temperature, it's 40 degrees. What determines the shape of the aligner now is the blue lines, it's the switching segments. Now, whenever you put the aligner into the mouth, the aligner distorts, right? So like for Invisalign or like conventional thermoform aligners, after like say a few days of wearing, the aligner actually gets distorted. It doesn't like maintains its shape anymore. Now for traditional aligners, then the aligners are done. So you can't like actually make the aligners come back to its previous shape again. So there's no point of asking the patient to keep wearing the aligner for like 2 more weeks or what. There's just no point of doing that. But the magic behind these shape memory effects for these LuxCreo aligner is that if you throw it into hot water, so like say 80 degrees, the blue zig lines, that's the switching segments, they become soft again. So once they become soft, the red lines, that's a hard domain, they come back again. Like they start to determine the shape of the aligner again. And they will pull everything back to its original shape. So this is shape memory effect. So shape memory effect, because the aligner has 2 components, one component with a higher glass transition temperature, another has a lower transition temperature. So whenever you put into the mouth, because the temperature drops, again I'm going to show this because it's a little bit complicated. Let's do this again. So when the aligner is first fabricated in the printer is in a much higher temperature, right? The printer is very hot. So when the aligner is first made, it's in a very high temperature. And the switching segments or the blue zigzag lines are very soft. They don't have any force at all. So what is holding or deciding the shape of the aligner are the red lines. That's the hard domain. Now, once the temperature drops, when you put it into the mouth, temperature drops and the switching segments hardens. So when it becomes hard, it overpowers the red lines, and the blue lines now determine the new shape of the aligner. You ask the patient to wear the aligner for a while, the aligner receives some external force from the tooth, so it gets distorted. If it's a thermoform aligner, it's done. It remains distorted. But because direct print aligner have this shape memory effect, it has these 2 components. It still has these hard domains which are in red lines, right? So once you put it into hot water, the blue lines, the switching segments that was holding the aligner during intraoral temperature, they soften up. So once it's softened up, the red lines or that hard domain, it comes back into the game again. So it will pull the aligner back to its original shape. So this is shape memory effect. This is how whenever you throw the aligner into hot water, it becomes hard again. So we have this chart over here. So again, it's just a brief summary of how you try to like recover the aligner's shape by throwing it into hot water. Now, so this is why for LuxCreo, they call their aligner 4D aligner. 4D is not just 3D because it's more dimension. It's one more dimension than 3D. So 3D dark print aligners is not just 3D, right? We don't have just three dimensions like width, length, height, but we also have one extra dimension that is time. Because if you throw into hot water, it recovers into its previous shape. So 4D aligner is when you have 3-dimensional plus the dimension of time by using a smart material. So the smart material is what I was just saying. So because if you throw into hot water, it recovers into its previous shape through shape memory effect. Now, so why is it so important? So because for aligners, for every kind of plastic, you experience this drop of force after a while. This is stress relaxation, right? For power chains, you have stress relaxation. For elastics, you have stress relaxation. For aligners, you also have stress relaxation. Now, for aligners that do not have this shape memory effect, once stress relaxation kicks in, the aligner doesn't have that strength anymore. It becomes useless. It's just a useless piece of plastic. But if the aligner has the shape memory effect through the mechanics, the mechanisms that I was just saying, the force goes up again once you go through thermal excitation. That's when you drop it into hot water. So the force becomes up again, and then you essentially, whenever you ask the patient to put the aligner into hot water, you're essentially giving your patient a brand new aligner. So the patient, instead of wearing one aligner or getting one aligner for a week, they're essentially getting a new aligner every day. Every time they throw it into hot water, the aligner reverts into its previous shape, and then when the patient wears that aligner, it's like they're wearing a new aligner. So that's, I think, one of the very big advantages of what a shape memory effect polymer can provide us. Now, for LuxCreo, the gas transition temperature is very high. It's much higher than body temperature. It's close to, I think, about 100 degrees. So that's why you have to throw it into hot water after, like, say, every day. Every day of wearing, you ask the patient to throw into hot water, put that in, soak into hot water for like 10 minutes, and then reverts back to its previous shape, so it retains its original strength. Now, it's a little bit different from shape memory alloy. So we're all very familiar with shape memory alloy, right? Shape memory alloy, there's some difference from shape memory polymer. So first of all, shape memory alloy is very hard to process. You can't just make a night-tie wire out inside your office, right? You have to order from, like, say, those companies. But if you have a printer over here, you can actually make this shape memory polymer inside your own office. So it has a lower cost, it has an easy processability, and it has a lighter weight. Now, the difference is that with shape memory alloy, it changes back to its original shape spontaneously. So whenever you place your night-tie wire into the mouth, onto the patient's teeth, onto the brackets, you don't have to do anything because it has this heat triggered thing, right? So it moves, goes back to its original shape spontaneously. But for shape memory polymer, it does not. So you have to throw it into hot water, sort of like an external stimulus, to push it back to its original shape. So it requires stimulus. Now, another, I think, very important thing, I think this is one of the key takeaways that I want you guys to remember today. So for shape memory alloy, intraoral temperature is considered the higher temperature, right? So for shape memory alloy, during ambient temperature, like room temperature, 20 degrees Celsius, the alloy is very soft. It's very flexible. Once you put it into the mouth, because the temperature rises, the night node becomes hard. So that's how, like straight wire appliance, that's how we try to move the teeth back. Now, this is exactly opposite to shape memory polymer. So remember what I was just saying? At a lower temperature, you're at a more solid state. You're at a gassy state. If the temperature rises from 40 degrees to 80 degrees, the plastic softens. It drops so for the strength or the rigidity drops from a gassy state to a rubbery state. Now, this is exactly opposite to night-tie. So for night-tie, mouth temperature or body temperature is a higher temperature. It's at a state where the night-tie is harder. But for plastic, it's opposite. When you put it inside the mouth, it's actually softer. So it's actually harder, so it's opposite. When you raise the temperature, it becomes soft. So this leads us to a question that I want to ask you. So if you go around and look at other booths, you might encounter some other companies that also have direct print aligners where they say their gas transition temperature. Relatively easy case, then probably. But if it's a more complicated case, say if it's an extraction case, when you want to bodily retract all the front teeth, is that force enough if the plastic becomes soft during body temperature? So for LuxCreo, what I think is pretty nice is that they have a gas transition temperature that is really high, so close to 100 degrees. So whenever you place it into your patient's mouth, the aligner is still at a relatively hard state. So it still retains that force you need to move the teeth. It doesn't become too soft. And then if you want to trigger the shape memory effect for that aligner, you don't do that through body temperature. You do that by throwing it into hot water. So you do that extra-orally. So the mechanism or the idea of harnessing shape memory effect into LuxCreo aligner or an aligner that has a higher gas transition temperature is that when you're using it inside your patient's mouth, it's still hard, it's still rigid. You move the teeth with a much higher force. But because of stress relaxation that you can't, just all plastic has a stress relaxation effect. So once you have this stress relaxation effect, once you have this stress relaxation effect and you want to get rid of this effect, you want to start to recover the strength of the plastic, you take the plastic out, you throw it into hot water, you soak it in water for like 10 minutes, the aligner reverts back to its original shape, reverts back to its original force. You ask the patient to wear that new aligner, and then that's how you keep the teeth moving with a much higher force. So that is why, to me, I think direct print aligner, especially LuxCreo aligners with a much higher gas transition temperature with a shape memory effect, it's not just optimization of our current aligner treatment. I think it's next generation orthodontics. And I think this is the future. Like, we're seeing the future here, and I encourage you all to start using shape memory polymers with a much higher temperature. So thank you all today.